how long does that stay in the teeth, whether it be the nanohydroxyapatite or fluoride? And again, the reason I'm interested is how can we get that fluoride out to put the better nanohydroxyapatite in?
Right. That's a great question. I don't get asked that often. It's very likely that the hydroxyapatite will be replaced. It will get demineralized and then remineralization will occur. Fluoride sticks a little bit better to teeth. That's one point, one pro that the fluoride activists really lean on. And that's fine. And it's true. Topical fluoride does work. And it dissolutes or comes out of the tooth at a lower critical pH. So if you stay above that lower critical pH, which you're more likely to do, then you're less likely to lose that patch. But it came at a great cost, and that was your IQ, and other things. It's a neurotoxin, and arguably the fluoride that's in the tooth is the least of your concerns. It's inert, it's there, it's not floating around in your bloodstream, it's not getting past the blood-brain barrier and causing inflammation in the brain. So, but it can dissolve out, but the hydroxyapatite itself is more likely, again, because it's like the rest of the tooth surface. Where the cavity occurs is based on where the food is collecting, where the biofilm is thickest, and where it's dysbiotic. Or it could be in an area that you're missing with a toothbrush or with floss. And so if it's the same spot every time, that over time will lead to a cavity because the tooth can't remineralize itself because it's always being fed this karyogenic cavity-causing food. And it may be a dry mouth. By the way, kids have a higher critical pH, which is mind-blowing to me. I never knew that. And this is an old study. They don't tell you that in dental school. So in other words, kids are more prone to getting cavities because the demineralization part of the equation starts earlier. Starts at a higher pH, closer to neutral pH, and that's why kids get a lot of cavities. That's not the only reason, but if you're a pedodontist, I can send you that study. That is really mind-blowing. So, but you can. I think what you're trying to ask is, can you get fluoride out of your teeth? It's possible. I wouldn't worry about it. If it's there, leave it there. If it comes out, you'll digest it and that'll be that. And you'll replace it with nano. So stop using fluoridated products. Filter fluoride out of your drinking water. Don't use fluoridated toothpaste or mouthwash. And you won't, you've cut it right there. I mean, there's no way to chelate fluoride out of your teeth. Just by using nanohydroxyapatite over time, your teeth will be very strong and you won't have to worry about the fluoride that's already in your teeth. Remember, when you're ingesting fluoride as a kid and your teeth are forming in the gum line, in the jawbone, the enamel organ, which is the pulp tissue of the tooth, it's getting fluoride's in your bloodstream, and it's systemic, and it's being taken up by the enamel organ. And so you've got fluoride. Most of us that were drinking fluoridated water, like I did, unfortunately, I grew up in San Francisco, and I checked, they had fluoridated water when I was around, and it was high. It was 1.3 parts per million. They've dropped it now down to 0.7. They've halved it. The fluoride was running around in my brain and my body, and the enamel organ was picking up the fluoride when it saw it in the bloodstream, got into the pulp tissue, and it was part of the lattice work and the matrix that it was laying down to form the tooth. So if you're trying to get rid of fluoride and you've grew up on fluoride, you've got it deep inside your teeth. But it's inert. You don't have to worry about it. Once it's there, it's there. It's like deeply embedded in that concrete bed. You're never going to see it again.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that,